My name is Dr. Christopher Kim. I'm an orthopedic sports medicine surgeon specializing in mostly athletic type injuries, but also injuries involving the shoulder and the knee and the ankle and so on. So when talking about shoulder injuries, they come in all shapes and sizes. Some people like to think of them as either an acute shoulder injury that happens from an accident of some sort, or you can have a chronic shoulder issues, something that's been nagging you for a little bit of time, or for a while. Depending on the shoulder issue that you have, we can approach it in different ways. Obviously, the more acute type injuries from an accident, usually there's some issue that needs to be dealt with right away, whether that's a broken bone or a torn tissue like a tendon or a ligament of some sort. And oftentimes they may require surgery, sometimes not. Or sometimes shoulder pain can be more chronic. It's been going on for a little bit of time, and it takes a good history and a physical exam to figure out exactly what part of the shoulder is bothering you. And depending on what the problem is, again, the treatments are sometimes surgery and a lot of times not surgery. So for a lot of shoulder issues, a lot of times it takes a little bit of sorting out to figure out exactly what part of the shoulder is bothering you and how. And depending on what the problem is, the treatments are variable. Sometimes they're non-operative. A lot of times they can be non-operative. And non-operative treatments often entail a good course of physical therapy, which are very specific to the kind of problem that you're having. Sometimes we consider injections, and injections can be in all different locations in the shoulder, again, depending on what the problem is. Every now and then that doesn't work, and if a patient continues to have problems despite maximized non-surgical treatments, sometimes we do have to consider surgery. Some shoulder problems are more obvious and we know don't do well without non-surgical treatments, and so oftentimes we talk about proceeding with surgery right away. And we have specific indications for that, and we know why something will need surgery or will do better with it. So oftentimes the recommendation right away can be to go directly to surgery. There's a lot of different kinds of shoulder surgery. Usually, generally speaking, if we're thinking about a soft tissue type procedure, let's say a rotator cuff repair, a labral repair, or a stabilization, the recovery can be somewhat long. We can talk maybe 5 or 6 months of physical therapy. A lot of times in our athletes, when they have a soft tissue surgery in their shoulder, it could be up to a year of recovery sometimes, so it can be fairly long. We do work hard in working with you though. Physical therapy is always involved. The patient will visit us very routinely so we can make sure they're on the right track and that they're making appropriate progress. So we also, there's a lot of, it's a long recovery, but during that time, there are a lot of visits and a lot of updates, and we communicate with each other a lot to make sure you're getting to where you need to be. So not all shoulder problems or shoulder pain require surgery, but it is important to know what's causing the pain, what's the pathology behind it, and how best to treat it, even if that means through physical therapy or other means. So, if you are having shoulder pain, it is a good idea to have it checked out, at least get some answers in figuring out, what's the root cause of it. Depending on what the problem is, especially here at the Iowa Clinic, we do communicate with each other a lot. For example, if we decide that you do need some physical therapy, well, we have a lot of physical therapists here, and we communicate very often, in regards to how the patient is doing. So it's not just, hey, you need physical therapy and see you later. It's actually a lot of communication back and forth with the therapist and myself to make sure the patient is making appropriate progress. If you are doing well, then hey, everything's great. If you're not, unfortunately, well then the physical therapist often will walk down the hallway and talk to me and say, hey, I think this patient is not doing very well, perhaps going in the wrong direction, and then we modify some of our treatment based on that. So we have a lot of communication with each other, and we work together quite a bit. There are a lot of good orthopedic surgeons and a lot of surgeons that will do a great job, but at the end of the day, I do think it's important that the patient and the surgeon has a good relationship and that they trust each other. Not only is it important that the patient understands, what the surgeon is saying, but it's also important for the surgeon to understand what the patient is saying and and what their goals are and, where they're coming from. Being a sports medicine surgeon, I've dealt with a lot of athletes and I've worked with a lot of athletes both at a recreational and competitive level. And it is important to know, what the patient's goals are and what they're trying to get into, and, what it really means to have to take 6 weeks off or 3 months off, or to lose a whole season, for example. So there are other factors involved aside from just what the MRI is showing us or what the actual injury is. So, depending on who the surgeon is and who the patient is, it is very important that they establish good expectations and understand each other and kind of know what the ultimate goal is. We try to make it as easy as possible for patients to reach us. One route is, of course, searching for us online. We're readily available. There's always a phone call. My nurses and my office staff know that I'm very open to having patients come in even on same day if they have an issue and they really need to be seen. I also have a lot of good relationships with a lot of the physical therapists and athletic trainers and teams in the city. And actually they have easy access to me. They'll often call me or text me with an issue with one of their athletes, and they know that they can get them in right away. So however a person wants to get in touch with me, whether it's a phone call, online, through our website, or even a call through their athletic trainer who may know me, or even their physical therapist, I have all of them on my mobile phone and they call me all the time. So we try to be as available as possible.